If you have set goals and you set the right expectations for your life, that a family medicine income is more than enough. Even on a family medicine income, it has allowed me to have my 2 kids. It's allowed me to help pay down my student debt. Family medicine has one of the higher opportunities for grants and loan forgiveness and loan repayments. Those are things that are benefits of working in primary care and specifically family medicine. The beauty of family medicine is that you're on teams and you're working with patients and you're constantly going through the traumas together, whether that's finding out diagnosis of cancer, finding out that a patient had a miscarriage. Who else in the world, other than your significant other, do you go and tell these really deep, dark secrets with, other than your family doctor and your spouse? It's a big privilege to be able to work in that role and be in that position as a family physician. Medicine,
law, friendship. This is Dr. Long and Lawyer Nik. You're listening to the Medico-Legal Brief.
one doctor, one lawyer, and a whole lot of gray area.
Welcome back, everybody, to the Medico-Legal Brief, where medicine meets the law. I'm Lawyer Nik, got Dr. Long here. And Dr. Long, last week, we kind of let you go on a little bit of a rant. We let you have a vent session. We let you talk about your frustrations with family medicine, medical systems, so on and so forth. It's time for you to do the exact opposite. We need to discuss everything you love about family medicine. You've invested a lot of time and effort. You've sacrificed a lot for the position that you're in, and I know that you absolutely love it. It's fair that you share the other side of medicine that not everybody got to see in that last podcast.
Absolutely. That last episode was, like you said, a venting session. There is no job that is like absolutely perfect 100% across the board. Even though I do love what I do, there are things that we already discussed. So if you haven't viewed that video, make sure you go back and check out the last episode. But now I kind of want to flip the switch and talk about all the wonderful things about medicine and family medicine specifically, and why I still enjoy every day waking up excited to go see my patients and do what I do every single day.
We've talked about before how sometimes you just fall into things. You might have an idea of where you want to go, where you want to end up. Talked about before how when you were in college, your goal was to be an anesthesiologist. You want to work something completely different. You want to specialize. And here you are now as a family physician. How did you find yourself into family medicine? You wanted to specialize, and then here you are. You made a decision to then pursue something that would dictate the rest of your professional career.
As I was going through medical school and as I was going through rotations during my 3rd and 4th year of medical school, you get to rotate through different specialties, including OBGYN, surgery, family medicine, pediatrics. And I found that I enjoyed every single rotation. I enjoyed being in the OR. I enjoyed cutting into people. I enjoyed delivering babies. I enjoyed dealing with babies and parents. But I also realized I didn't want to do the same thing every single day. It just made sense that I would go into family medicine because guess what? Every 20 to 40 minutes, it's a different patient with a different complaint, with a different issue. It allowed me to almost keep my ADHD brain going because then I wouldn't get too bored on one specific topic. I couldn't imagine going into a day and just seeing 20 patients that all I could talk about was their heart, and it was everything about their heart. I get to do everything. I get to do heart, skin, lungs, everything. It's awesome.
As cheesy as it sounds, do you feel that you found family medicine or family medicine found you?
Both. I had an idea of the type of doctor I wanted to be, and I thought it was someone that just needed to make a lot of money, but also be in a prestigious role in the community. And then as I started to go through my educational journey, I realized it wasn't all about that. It wasn't all about the prestige and reaching for these big goals that we're always constantly reaching for, but it was also that self-satisfaction. What satisfied me? And I realized that it was those relationship building aspects of family medicine that really pulled me into the specialty.
And that's a good pull in from our episode last week where you were talking about the frustrations, because there are instances in any career, I felt it in law, where you have this idea of what the career is going to be. And then you get into it and you say, this is not what I thought I was signing up for. I don't want to deal with A, B, or C. And I'm actually waking up and I'm really, really unhappy. Some of the points you made last time were work-life balance, being low on the hierarchical totem pole, lower salary compared to other physicians who specialize. Even though those are some of the frustrations and struggles as a family physician, I get the impression that you knew that those were going to exist and you still signed up anyway because that's what you were drawn to.
Exactly. And I knew that with my history of being the first to go to college, graduate college, go to medical school, that there was going to be a lot of uphill battle anyways. I was going to be paving a new way for myself and my family. I knew no matter what I chose, it was going to be a tough road ahead. But I knew that this was going to be possible because I loved it and I set my goals on it. And I've attained, honestly, in my lifetime, I've attained every goal that I've ever wanted to reach.
Yeah, you've been pretty successful. You've been pretty good at doing that. That's something that a lot of people don't hear when they see clips or when they watch the podcasts and they hear you talk about one instance of something. There's the instance that the counter does not exist. So even though you went on and you discussed your frustrations, you still knew exactly what you were getting into. And that's something that is very introspective and people need to be more aware of. The fact that those two things can exist simultaneously. You can actually really, really want to be in a role and really pursue that role, knowing the downside to it. You're still entitled to complain about that downside. I mean, there is this notion of, well, this is what you signed up for, stop complaining. But part of life is the ability to complain when you're working your ass off and you're trying to make change and you have these struggle points, health insurance, angry patients, medical systems that are inefficient. Like, that's really important for the audience to know. You knew exactly what you were getting yourself into and you signed up anyway.
I knew that whatever efficiencies or problems I saw within the system, I knew that I could break away from them and pave my own path, or I could help change the system or make a difference within the system. That has always kept me motivated because I see that a lot of people, especially physicians, who get into a career and then they just coast, and that's when they start to struggle with motivation, enjoyment, and coming to work. It's a struggle, but I find that every day I'm constantly looking ways around the barrier, maybe breaking through the barrier and paving a new pathway for the generations below us.
Well, I asked you this question to start the show last week, and so I'm going to do an inverse of the question. I asked you last time, what are the things that you dread when you wake up in the morning to go to work? So what are the things that you absolutely look forward to every single time you wake up? What are the things that get you out of bed when it comes to your career and your profession and what you're experiencing in medicine?
Honestly, the most exciting thing I get to do is get into work, look at my calendar, look at my schedule, and see all of these amazing patients that I've created relationships with. And now is another time I get to check in on them, get an update on their life, see what's been going on, what happened over the wintertime, what happened during that snowstorm that we had. These are the moments where it's truly sitting down and just having a conversation and getting an update on their life. It really excites me to have that opportunity, especially if it's a patient that I know that I mesh really well with. Their personality is really fun. They come into the office and they just help light up the office. And then we just vibe off of each other. Yes, we're going through their medical history and their medical health and their current issues, but we're also just enjoying the conversation. It's always exciting to be able to catch up with them almost like an old friend.
Yeah. And law, we had that as well, where we had our favorite clients that would come in where you knew you wanted to set aside a little bit more time. Maybe you wouldn't fill that meeting spot directly after them because you knew you wanted another 15 or 20 minutes with them. You were invested in what they were doing. Being in divorce, we were invested in what they were doing with their children or maybe their dating life. Maybe they went through a rough divorce and now they were looking to hop back on the horse and find another man or another woman or another partner. And that was always exciting to hear about. So I can definitely relate to that a lot. Now, do you feel with that there is maybe a thought in medicine where you shouldn't be that invested in your patients? Obviously, you want to be invested in their health, but it seems like you take the step past that and you're invested in them as people. That's important, but do you think that all doctors are taking that approach?
No, I don't think all doctors take that approach, but I also think that that's why it's unique to family medicine, because family medicine, that's what we want. That's what we need. The doctor that you're going to see the most often in a year, you want to make sure that your patient relationship with the doctor is comfortable and you're able to tell them every little secret, every little detail that needs to be known so that we can make sure that we guide you appropriately for your health.
The rapport definitely helps build that trust too. Because there have been times where you go into the doctor and you want to talk about something that you deem as embarrassing and having the trust of the doctor say, hey, look, this is what I'm dealing with. And then their response is, All right, let's take a look. You don't feel judged. You feel like you're getting the type of medical treatment and medical guidance that you want. That's important with any doctor, but specifically, like you said, your family physician.
Yeah, and I think that nowadays, when so many doctors leave a certain area and they start a job, after a couple years, they then transition to a new role. I love that family medicine. Usually, the tenure is quite high. We're spending 5, 10 years in a place so that we're growing with our patients, and so our patient panels get to know the doctor very well. I would say that even though I've only been here for 2 years, and I'm not just saying that for the podcast here, but I legitimately enjoy 80 to 85% of my patient panel. Yes, the other 15% are difficult, but I wouldn't even say that I dislike them. That's also what gives excitement to what I do, because not every patient is easy. There are a lot of puzzles that I need to sift through and put together so that I can see what the final diagnosis and issue is, and we can come up with an appropriate treatment plan. And that's the beauty of family medicine. You have 2 easy visits, and then you have that one really difficult one. Your brain is constantly going. It's always working.
The other thing to that too is just thinking in general, there are very few professions out there where you get to pass down or have a generational interaction with that profession. With us having kids now, obviously you have to go the route of a pediatrician, but as a family doctor, when we were done with our pediatricians as teenagers, my parents were like, okay, well, we have this family doctor. You are going to go see this family doctor. And I still see that family doctor. I've done that with our dentists. I will do that with my barber. Like my dad saw my barber before I went in, and now I see the barber. And then if I have a little boy, he'll go see the barber. It's nice that that generational impact is there as you go through your career. You are going to see kiddo turn into adult, turn into parent, turn into grandparent, while also seeing every aspect of their family tree, essentially.
Exactly. And it really helps build on that family history, because not every patient is that thorough and understanding of their own family history. If I'm able to see the patient, their parent, and their grandparent, I'm going to know if there's any genetic disorders or maybe things that are out of the ordinary. Maybe their grandparent had a colonoscopy that was abnormal. I would be able to know that and actually guide the actual patient who's within that lineage, and make sure that they get the appropriate screenings and do the appropriate tests that we need to make sure we stay on top of things.
You always like fill out the questionnaire that's like, do you have a family history of so and so? And you think back to like, I don't know, did dad have this or did grandma have this? But if they're still in the system from a generational standpoint, hey, let me just go look at the file. I'll tell you exactly what was going on with your dad, and I'll figure it out. As long, again, legal, you're not violating HIPAA, but you get the idea of what you need to look out for the next generation.
Exactly. It makes it a lot easier when you are doctoring as a family with the same doctor, because then we can HIPAA compliantly go into charts and review things, and then also make sure that we're not missing anything.
So you love the people. We know you love the people. And it's always funny because we've talked about you being the biggest introvert, and being a doctor, at least in your position, is a very extroverted job. You got to run that social battery all day long, almost every day, and then go home and still put on for your husband and your kiddos. Other than the patients, what other areas of your career do you really, really like and enjoy?
The fact that I could wear multiple hats, I've been able to jump from not only rural, urban, suburban practices, but I've been able to jump between profit, nonprofit, private, and corporate. I've also been able to tap into specific skill sets that I've had. As family medicine, I can choose to only see adults, or I can choose to only see pediatrics, or I can choose to do OB and deliver if I wanted to. Those are the wonderful things that I've gotten to do in the past. Currently, though, the new thing that I've discovered is that I have started teaching. I am now a part of faculty for one of the family medicine residencies near my area. And I've enjoyed teaching because it not only opens that door for me to work with new doctors or soon to be full-time attendings in a capacity where I'm teaching them in a clinic setting, but also in a hospital setting. It really keeps me up to date with medicine. It forces me to stay on top of those things. But it also is nice to keep in contact with that younger generation to make sure that I'm understanding all of the struggles and difficulties and trials and tribulations that they are going through, because their issues are different from the issues that I went through. And I don't want to ever feel like I'm falling out of touch with that. This really keeps me in line with what the current generation of doctors are dealing with. And hopefully I can help advocate and improve the system moving forward.
One of the big things I notice when I'm working with students is the generational slang and the words that they use, where I feel so old when I sit down for a conversation. And it's not that they're being unprofessional. It's just there's different terminology and different slang being used. I'm like, wait, what is that? What are y'all talking about? I feel old. I definitely feel old. I don't know if you feel the same way when you're starting to hear the new slang come out the door.
Absolutely. But you know what? The nice thing about doing all that is that I get to do it in the safe space with my residents who, yes, they're going to laugh at me, but it's all in jest. They're willing to teach me. Then I get to use it with my patients. And then it seems more genuine. It seems not as cringy after I actually understand how to use it and when to use the slang that you're talking about.
Yeah, cringe is the best word. If you're using it wrong, and the generation below us will let you know that you're being cringe. They'll let you know that you are out of line with how you're using it and that you just probably shouldn't say it. And that's pretty embarrassing, but the safe place is nice.
Absolutely. So the other thing I want to make sure I mention about family medicine is that we manage health throughout an entire patient's lifetime. And so I've also recently done a side gig in what we call hospice. So hospice is kind of that end of life care when a patient has a terminal illness and they've decided they no longer want to go through the normal health system itinerary, meaning going in and out of the hospital, getting treatment. Their goal is just to live comfortably for whatever amount of days they have left. That's been a new, very enjoyable aspect of medicine that I've touched into. And you don't get to do that with every single specialty. If I were a surgeon, it would be hard and difficult to jump into that hospice space. Doesn't mean you can't, but it takes a little bit more education, a little bit more time. Whereas family medicine, because we are comfortable dealing the gamut of a lifetime, it just makes sense that it was easy to transition into that role.
Now, the experiences that I've had with hospice have always been with a family member or a close friend passing. Those instances of interaction under that circumstance have always been very, very sad, very calming, but also a lot of frustration, some anger, dealing with other family members and friends. Death is not easy. How do you find the joy in working in that atmosphere? Obviously, you're helping a family and a patient out in their final days or final weeks. But how do you actually find that joy and make it worthwhile to where you feel like you're making a difference and you're walking away with more of a positive insight on things as opposed to bearing the weight of a death?
It's twofold. It's the one place that I feel like we truly listen to the patient and actually pursue the patient's goals to its fullest. Their goal is to de-escalate medications. I love to do that. It's something that is so easy to do at the rate that they want to do it, but also keeping them comfortable, whether that's due to pain, anxiety, breathing. Being on hospice and having the team that you work with, it just makes it so much easier. And so that second half of why it's so nice and fulfilling to work in hospice is the teamwork. You have this entire set of teammates, from the nurse to the social worker to the chaplain to the nurse practitioner, physician assistant. We all work as a team to make sure that not only the patient gets the care that they need, but also the family members surrounding the patient gets the care that they need. Because that's the nice thing about hospice is that it encompasses all of that. They take care of the entire unit, not just the patient alone. Those things have been really fulfilling and really makes it just a really enjoyable area of medicine that surprisingly I found nice over the last year. But your question in terms of dealing with or managing those emotions around surrounding a death, at the end of the day, if you feel like you're truly helping the patient and you get them to their goal, which is passing peacefully, it only makes you feel that much better that you've helped this patient truly get to where they wanted to go.
Do you feel like any of the family members are ever angry with you or your staff under those circumstances? Like, do you ever feel you are being blamed even though you've come in to help the situation?
Rarely. And that's the beauty of hospice. When a patient goes on hospice, it's a whole family conversation to get them on hospice. We got to make sure that everyone understands, believes it, buys into it, and is agreeable for the patient to go on hospice so that we as a team can then jump in and intervene and help. Usually when a patient passes, family members are actually very happy and thankful for what we've done for them and how much we've been able to take away some of the pain, the anxiety near the end of their death. It's an interesting perspective because You're right. Usually, if we were thinking about someone dying in the hospital from pneumonia or sepsis or something, patients and family members are going to have a very different reaction to the doctor taking care of them there versus the doctor also dealing with the death of a patient on hospice.
And in no way am I trying to compare my experience as a lawyer in divorce to that of a doctor dealing with hospice and death. But I felt like there was a little bit of that in the law where you were trying to help people get through some of their hardest times, and there's some fulfillment in that. But there's also the scenario where you're trying to emotionally balance and regulate what's going on around you, and you don't want to necessarily embody that stress and embody the negative emotion. You want to be able to turn it into something positive. And that's something that I'll discuss when we go into the reasons why I left the law. The burdens and the weight and the stress and the burnout, which is a lot of things that you talked about. It's very easy for something like hospice to put you in that mindset if you let it. You as a doctor and one of my best friends, you've always had positive mindset to these things as to, okay, how do we make the best out of this situation? Even if it's one of those darker scenarios, we can still find the light in what we're doing.
That's not unique to me. That's unique to physicians and doctors and providers who are interested in going into hospice because it does take a certain personality and a unique perspective on life to be able to handle those sort of emotions and situations.
Awesome. Now, a good transition out of the hospice discussion. You had talked about your team on any given day, whether it's working hospice or working in the clinic or being in the ER. You are working with the team. What do you love about your team? What do you love about the people that you work with?
I truly feel like in the last year and a half, 2 years, I've found my team, the team that I really work well with, going from, the front desk PSR people who are triaging patients back to the MAs rooming my patients to the nurses who are taking triage for my own calls and issues. And then the other physicians, nurse practitioners, and physician assistants that are in the office who I see their patients, they see my patients when they're not able to. And just that interconnectedness and conversation that we're constantly having to make sure that we're all on the same page, pushing our patient panels to a specific goal and specific health, and that we're all in agreement across the board. When it comes down to the nitty gritties, like dealing with certain prescriptions and whether or not we're in agreement to prescribe this type of a medication to this subset of group of patients or not. It's been really nice to find a team that we all have similar goals. And I appreciate everyone that is on the team, and I appreciate everyone that has helped me and given me the opportunity to help them. It's been a blessing, honestly, because the prior team that I worked on was the opposite. It was stressful all the time. I enjoyed and I loved my job, but then that was it. Like I loved my patients and talked to my patients, but when it came around to talking to the other team members, it became quite difficult when everyone on the team has a different perspective or a different goal and reaching for different things. It becomes hard to manage patients together and work together towards a goal because the goals aren't common.
Completely agree. The team could really make or break your working environment. In all aspects of my career, the people that were around me were the people that really helped dictate the enjoyment of my day. I could have loved my job, could have loved what I've done, but if the people around me were too negative or they added too much stress, I wanted out. If the people around me were able to build me up and let me build them up to where we were successful and efficient, it was the best thing ever. So when I talk about teammates, there are people in my head that specifically stand out. For you, not naming any names, do you have those individuals? Do you have those favorites that you're like, I absolutely love working with this person? And if so, what is it about their attitude or their work ethic that makes you feel that way about them?
Absolutely. In a team or a workplace, you always find those one or two people that you just mesh better with, whether that's personality, work ethic. It's usually someone that's also very type A. And we're sitting there just trying to like vet through problems, patient problems, system problems, and just moaning and groaning together, but then also coming out on top together. And so, yes, absolutely having people like that around has been great. In fact, I'm going to give a shout out to the residency team that I just joined in the new year. I have one specific colleague who kind of recruited me, I would say. She's really helped me get into my role and find my place. She's almost as neurotic as me, and she's very type A. And so it's quite funny to sit back and sometimes just watch her and be like, that could totally be me if I wanted to take on that leadership. But you know what? I'm going to let you keep that leadership role and you stress out, and then you can come back to me. And then maybe one day we can return the favor. It's like that trauma bonding over trauma. We do that in medical school, we do that in residency, and I feel like we do that in real life too now on the job.
When you say trauma bonding, it almost feels like there's this negative connotation, but that's like a real thing. When you're around people all day long and you're going through the same quote unquote trauma, whether it's as serious as somebody passing or it's as simple as the office outlook going down where nobody can access their emails, like that's the trauma bonding because it puts you guys in a very similar situation, allows you guys to work through it together and become stronger. You get to really see how your peers and your colleagues deal with the stress of the situation. You can help provide feedback or get feedback on how to become stronger. To your point, you can sit back and watch somebody and say, all right, what is it that they're doing? Is that something I want to embody? Is that something I'm capable of embodying? Is that something that I want for myself and how do I get there? As negative as it sounds when you say trauma bonding, it's important in a lot of aspects of life to just be in the dirt with somebody. When you're in the dirt with somebody and you're going through with somebody and you get out on the other side, you almost have this everlasting connection to them just based on that one thing. I remember traveling a lot for aerospace, and there may have been an individual, a buyer or an engineer that I went on one trip with. And just the notion of us going through a 3 or 4 or 5 day negotiation, months later, without working with each other anymore, we would still come back to the trauma of that trip of what we had to go through and the nitty gritty. And we shared that. We shared that connection, even if we never worked with each other ever again.
Yeah. It's interesting because obviously the person that you want to have the most trauma with is also probably the one that you want to marry and be with forever. And that's the beauty of family medicine. You're on these teams and you're working with these patients and you're constantly going through the traumas together, whether that's finding out diagnosis of cancer, finding out that patient had a miscarriage. These are all traumas that we share together and is the negative of family medicine, but also just the beauty of family medicine as well. Who else in the world, other than your significant other, do you go and tell these really deep, dark secrets with other than your family doctor and your spouse? Some patients don't even tell their parents, don't even tell their kids some of these secrets. I mean, it's a big privilege to be able to work in that role and be in that position as a family physician for sure.
And just like lawyers, just like doctors, you are usually the one delivering the good news or the bad news. There's something to the good news and the bad news. You know, there is such a relief and a hope and a blessing when you're delivering good news, but there's also such a worry and a concern when you're dealing the bad news. But even when you're dealing the bad news, you're still trying to make a positive out of it, saying, this is how we're going to handle it. This is how we're going to approach it. We're not going to lose hope, but we're going to do our best to try to come out on the other end. And a lot of the times when families are going through those hard things, for instance, a terminal illness or a health issue, doctor or the medical staff, you guys are like the first line of communication for starting that process. You are the one that has reviewed the charts or reviewed the test results and saying, this is what we have. And from there, you're building on a medical journey or a path forward.
Right. Another just wonderful aspect of the relationship that family doctors get to build is being that comfort place to give bad news. Most patients would rather hear bad news from someone that they know, someone that they trust, versus someone that they don't know at all, a stranger. I imagine most people finding out that they have cancer while they're in the hospital for another issue probably would be a lot more shocking and detrimental than hearing it from their family doctor in their office, who they've known for the last decade of their life. Because then I feel like there's that trust, but also there is some positivity in that too, some optimism almost.
Yeah. And the fact that you know the patient intimately, you know what their eating habits are. You know already off the top that what their prescription medications are, their health issues, their family history of, we already discussed. When you're able to deliver that message, you're also likely able to deliver a more accurate message and a more accurate medical plan for how to take this on because you already know all the factors because that person has been seeing you for so many years or generationally.
You just actually triggered something that made me smile. I've had so many patients where I've had to give bad news, but I've already anticipated their answer and what they would want to do in terms of follow-up, in terms of treatment, that I've already usually had it all set up because I know this patient's going to choose this and they're going to want to see this person do this thing versus the patient that I know is not going to want to do anything at all. It's just being able to anticipate that for my patients. And it's wonderful to be able to do that for patients and be able to feel like I am doing something to help people.
That's awesome. We've gone through patients, we've gone through your team. I want to ask you about the medical systems. What are some of the good things about the medical system? And you said that you've moved around a little bit. You've gone from rural to urban, a few different types of medical systems. What are the positives of the medical system?
As inefficient as the health system is, and as inefficient as our US healthcare is, I am able to work with what I've got. And I do feel like I am in a place where I enjoy working as an employee rather than an owner. I know that I am way too type A to be able to open up my own private practice without putting everything into it, where I'm constantly monitoring every penny that gets spent and making sure that every patient is following exactly what I want. The fact that I could go to my employer, tell them that, hey, we're short on a specific tool that I need. Can you just order it for me? And they have to figure it out in their budget. They deal with that. I don't have to worry about that. The fact that if I'm looking for more patients or a specific kind of patient, the employer will go out and advertise for me. I don't have to worry about that. The other thing is that by working for a health system, you do have a team of colleagues who take call for you, with you, rather than me being the solo owner taking all of calls from the patients. I can say, oh, I at least know I have these couple of days off because one of my colleagues is taking call for me and answering messages that are urgent. Those are the nice things about the health system and the way that we have things set up. It really ties into that, like, that colleague, that network, that teamwork that we really look up to in family medicine.
Well, Dr. Long, I hit a lot of the points. I will say that I appreciate the insight that you've given on both sides. You've been very transparent. You've been very honest. I just want to give you the floor for any final words. You have so much information and joy for what you do that this is a very important podcast for those looking to get into family medicine. So I want to give you the floor.
I've touched in the past that, family medicine is on average one of the lower paying specialties in medicine. However, the income is not bad at all. It really comes with expectations. If you have set goals and you set the right expectations for your life, that a family medicine income is more than enough. And I feel like that's what we've done in my personal life, is that even on a family medicine income, it has allowed me to have my 2 kids, one via surrogacy, one via adoption. It's allowed me to help pay down my student debt. Family medicine has one of the higher opportunities for grants and loan forgiveness and loan repayments. Those are things that are benefits of working in primary care and specifically family medicine. I got to enjoy some of those rural grants when I worked out in a rural setting. They helped pay down some of my student debt. The fact that if I wanted to work more, I can. If I wanted to work less, I can. Those are the nice things about family medicine that I don't feel like other specialties are allowed that sort of ease. Sometimes that you're kind of forced, or you feel like you're being forced to do a set amount of hours no matter what. Family medicine has the ability so that you can, if you want to have kids and go on maternity leave or work only part-time so that you could be home with kids, it's allowed. Most systems, especially my system currently, a lot of the docs are only half-time or 3/4 of the time. And it all works out because patients still get seen. I really enjoy my career, and so far I'm only 5-6 years into it, and I know that I have at least another 20-25 years ahead of me, and I don't see myself slowing down at all. In fact, I tried to slow down. I tried to slow down in the last 2 years, and over a span of a year, I've picked it right back up. So I really enjoy what I do, and I want to make sure that anyone that is thinking of going into family medicine, that they found this episode to be really helpful and informative, because I feel like these are things that we don't think about or talk about either. When we're picking specialties, we're constantly thinking about work-life balance. We're constantly thinking about the income, but we don't talk about those relationships that we build and those other important aspects of the career. That is a great place to end this episode, where I just got to talk about the love of my life, other than my husband, the love of my life, which is my career in family medicine. Thank you for joining us here on the Medico-Legal Brief with Lawyer Nik and me, Dr. Long. Please come back, check in on us. We have an episode that comes out every Wednesday at 10 a.m. Central Time. We're also on social medias like Spotify, Instagram, and TikTok. Follow us on there as well, and just show us some support. And we love responding to comments, so leave as many as you want. Thank you.
Yes, we're doctors. Yes, we're lawyers. No, this podcast is not medical or legal advice. Do not take anything we say as a reason to perform your own heart surgery, represent yourself in court, or diagnose your neighbor's rash. This is for entertainment only. Think of it like hanging out with your smartest, wittiest friends, not a substitute for an actual appointment. If you act on anything we say without talking to your own professional, that's on you. Seriously, don't do that.